Assalamu alaikum. I am Dr. Moyeedul Islam, Associate Professor of Pharmacology, Sakina Newszonebd Medical College, Jashore. It is the second session of anti-diabetic drug and it is the second part of the insulin. In first session we discussed about the structure of the insulin, the synthesis of insulin and storage of insulin. Now today's session is based on the release of insulin or secretion of insulin, or how the insulin is secreted, what is the mechanism of action of insulin secretion and regulation of insulin secretion. That is the factors that regulate the insulin secretion, some factors which involve the increase in insulin secretion in different situation, and some factors are involved to inhibit the insulin secretion in different situation. So let's discuss the secretion of insulin. So this is the pancreatic beta cell and it is a 7-membered transport that is called the glute 2 transport, and this transporter is present into the surface of the pancreatic beta cell, and this transporter is responsible for entry of glucose into the pancreatic beta cell. So from the outside the glucose is entered into the pancreatic beta cell, and entry of glucose into the pancreatic beta cell, it becomes glucose 6 phosphate by glucokinase enzyme. Then this glucose 6 phosphate becomes glycolysis, and from the glycolysis pyruvic acid is synthesized. Then this pyruvic acid goes into the beta cell mitochondria. And in the mitochondria it enters into the TCA cycle, from which it produces acetyl-CoA. This acetyl-CoA then goes into the mitochondria is another pathway that is called the oxidative phosphorylation. From this oxidative phosphorylation, the glucose convert the ADP into ATP, and this is the production of ATP into the pancreatic beta cell, and this ATP is highly sensitive to a channel that is called the potassium channel. This is the potassium channel. And normally potassium goes outside from the pancreatic beta cell. From inside, the potassium goes outside to the pancreatic beta cell and maintains its resting potential, because it is the positive ion. When the positive ion goes outside to the pancreatic beta cell, the cell becomes negatively polarized, and that is the resting membrane potential of pancreatic beta cell, that is 70 millivolt. Normally the function of the potassium channel into the pancreatic beta cell, that the potassium goes outside to the pancreatic beta cell and maintain the resting membrane potential of the pancreatic beta cell. When the ATP is produced more, because excess glucose is entry due to diabetes mellitus, the excess glucose is entry into the pancreatic beta cell, excess ATP is produced. When there is excess ATP is produced, it inhibit the potassium channel. It inhibit the ATP sensitive potassium channel, and so in the cell the concentration of the potassium become increased. and that causes the positivity inside the cell and changing the resting membrane potential into minus 50 millivolt. And when the ATP blocks the potassium channel, the cell becomes highly polarized, and this highly polarized cell is called depolarization, because there is increased positivity into the cell and inhibit the negativity into the cell. That's the increased positivity into the cell that causes the increase the potassium concentration in the cell, and this increased potassium concentration in the cell causes depolarization of the cell, and this depolarization causes opening of a channel that is called the calcium channel. This is the calcium channel from which the calcium enters into the cell from higher concentration to lower concentration. So calcium channel is opened because ATP sensitive potassium channel is blocked, and that's why there is depolarization into the cell, and that's why from the outside the calcium enters into the cell vigorously. When the calcium enters vigorously into the cell, it causes fusion of the secretory granules or secretory vesicles to the surface of the pancreatic beta cell, and from which the insulin is released by exocytosis. So this is the mechanism of action of insulin secretion. So how insulin is secreted? When glucose enters to the pancreatic beta cell through the GLUT2, the glucose converted to glucose 6-phosphate by this glucokinase. When glucose enters into the cell, it becomes trapped. When it is trapped, when the glucose converted into the glucose 6-phosphate, the glucose cannot be goes out to the cell. So when it is converted into the glucose 6-phosphate, it becomes glycolized and produce the pyruvic acid. From the pyruvic acid, they goes into the mitochondria of the pancreatic beta cell, and through the TCA cycle and acetyl-CoA, they produce the acetyl-CoA, and from the acetyl-CoA they goes into the oxidative phosphorylation, from which the ATP is converted into the ATP. This highly ATP concentrated into the cell that blocks the potassium channel and increase the potassium concentration into the cell and makes the cell depolarized. When the cell becomes depolarized, then the outside the calcium, there is a calcium channel, and from the outside the calcium enters into the pancreatic beta cell from higher concentration to lower concentration, because the calcium concentration is higher outside and inside there is lower concentration. So higher concentration to lower concentration calcium enters, and calcium dependent exocytosis of the insulin, because the secretory granules then fuse with the surface of the pancreatic beta cell and release the insulin. Now we discuss about the factors regulating the insulin secretion. The factors regulating the insulin secretion, if we say that the how insulin is released much more, because of when we intake high glucose, the high glucose enters into the pancreatic beta cell, and through this mechanism the insulin is released will be high. When we intake high level of protein intake, and this protein is called the leucine and arginine, that is the glucogenic amino acid. When the glucogenic amino acid intake is more, then there will be insulin secretion will be more. When we intake high intake of fatty food, they convert it into the fatty acid, and this excess fatty acid increase the insulin secretion is more. Insulin secretion is always dependent on the GLUT transporter. Another this is the GLUT2 transporter, and this GLUT transporter is very much important in this secretion of insulin, because there are 5 types of GLUT transporter. There are 5 types of GLUT transporter: GLUT1, GLUT2, GLUT3, GLUT4 and GLUT5. In pancreatic beta cell, the GLUT2 is present. Not only the pancreatic beta cell, the GLUT2 is present in intestine or enterocyte, the kidney and pancreatic beta cell. These are the important sites where the GLUT2 transporter is present. There is a important thing that some drugs also release the insulin. and the drugs are the sulfonylureas. The sulfonylureas, that is the insulin secretagogues that helps to secrete the insulin from the pancreatic beta cell. The sulfonylureas, mainly the first generation, composed of first generation and second generation. The second generation drugs are glyburide, glibenclamide, glipizide. They stimulate the pancreatic beta cell and release the insulin, but they release the insulin when there is 30% beta cell is active, then they can act. If the 30% beta cell is not active, they cannot act, because they causes the pancreatic beta cell to be stimulated, and this stimulation of the pancreatic beta cell causes the release of insulin through this mechanism. So sulfonylureas are the drugs that causes the stimulate the insulin release. Also the meglitidenide and D-phenylalanine derivatives, that is the ripaglinide, nataglinide, these are the drugs also causes the insulin release. There is another drug that also we call the insulin secretagogues, that is the incretin mimetics, or we called it incretins. Incretin is a gut hormone that helps to stimulate the insulin release, and it is glucose induced insulin release by these incretins. This incretins is mainly composed of glucagon like peptide 1. This glucagon like peptide 1 is not glucagon, it is glucagon like peptide 1. And another important hormone that that reveals in the incretin, that is the glucose dependent insulinotropic peptide. These are the two important hormones of incretin. Incretin is a hormone that is released from the gut when we intake orally glucose intake. When we intake glucose orally, the gut release the incretin, and incretin causes stimulation of the pancreatic beta cell and release of the insulin. And this is the incretin effect. When we intake oral glucose, the insulin secretion is very much more. If this same amount of glucose, if we take intravenously, the insulin secretion will be less, or less insulin will be secreted. So oral glucose induced insulin secretion, it is the incretin effect. And there are some drugs that we call the incretin mimetics, that is sitagliptin, vildagliptin, linagliptin. These are the drugs that belongs to incretin mimetics, and these drugs act as a DPP4 inhibitor. What is DPP4 inhibitor? The GLP or glucagon like peptide 1, that is the liraglutide, albiglutide. These are the important drug that reveals in GLP-1 analog, and this GLP-1 analog is breakdown by dipeptidyl peptidase enzyme 4. If we inhibit the dipeptidyl peptidase enzyme 4, the GLP-1 level will be increased. When the GLP-1 level is increased, that act as an incretin, and that's why these GLP-1 analog or GLP-1 agonist and the DPP4 inhibitors are called the incretin mimetics. Also some other hormones in the gut that act as like as incretin, that is the secretin, that is the cholecystokinin, that is the gastrin. They all act as an incretin, and incretin causes glucose induced insulin secretion. Not only incretin helps in glucose induced insulin secretion, it helps to suppress the glucagon. It also delays the gastric emptying. And the number 4 action of incretin is it stimulates the appetite or satiety. If we say that satiety is the right condition, when the incretin is secreted and we take food, the incretin helps the hypothalamus that the patient is satisfied with this food. There is no intake of more food. So this satiety is helps to control by this incretin. So these are the important action of incretin and incretin mimetics, and these drugs are help to secrete the insulin. So these are the important drugs that stimulate the pancreatic beta cell and release the insulin. And there is some hormone, that is the glucagon, cortisol and growth hormone. They also stimulate the insulin release. Also another parasympathetic activity, when we see food, when we touches the food, and when we feels to eat the food, and when we have desire to eat the food, the insulin is secreted. And the parasympathetic action goes through the vagus nerve, and vagus nerve secrete the acetylcholine, and acetylcholine acts on the pancreatic beta cell through their muscarinic receptor, and this muscarinic receptor helps to secrete the insulin secretion.